Yes, thank
I'll
you.
start the recording.
This meeting is being recorded.
Okay, so just start with the situation update. Not surprisingly, we continue to see record numbers of cases of COVID. If we look at the last week, we are adding almost 4,500 new cases to our case count. So we currently stand at over 50,000 of our residents have had COVID-19 infection. So our current case count is 51,383, which represents a 4,454 increase since last week. We know that testing was muted over the last 2 days, so we expect that the number is significantly higher than that. Also, given the access to testing over this week, I would not be surprised if our numbers drop just because of access to testing. So that's, we'll have to see what happens next week. I am hopeful that this means that we are near or at peak, but only time will tell. I don't have our hospitalization data yet because of the long weekend and because of some delays on hospital reporting. We won't be able to update that until later. So I can provide that information to you separately. With respect to where we are, if we look at the last week of full data from the state for the week ending in January 8th, which represents both the current vaccination rates as well as the impact that Omicron has had on our community. Across the state, people who were unvaccinated were almost 60 times more likely to get infected and almost 35 times or more than 35 times more likely to be hospitalized. So once again, our evidence is overwhelming that while people who were fully vaccinated can get COVID infection, and we know that it is an imperfect tool to prevent infection. What we do know, it is a very effective tool at decreasing the risk of hospitalization and death. And so it does protect against some infection. We see 60 times more cases in people who are unvaccinated compared to vaccinated. But when we have this much disease activity, you're going to hear a lot of stories of people who are vaccinated who still get COVID. Thankfully, the risk of hospitalization and death is much lower. So that's really the most important update that I have for you. Our vaccination rates continue to slowly tick up, and we continue to do everything in our power to make sure that everybody knows what they can do to minimize their risk of getting severely ill or hospitalized with COVID-19. And so with that, I will open it up for questions.
Dr. Morrow, this is Leanna Scacchetti with WDBJ7. We've been hearing a little bit. I just wanted to know if you had any other additional information or updates about the, and sorry if I missed this at the very beginning, but the testing clinic coming to Roanoke that was one of 9 set out by former Governor Northam, and then also any potential additional offerings or support on testing from the federal government.
Well, so thanks for asking that question, Leanna. We are extremely hopeful that we should be able to announce our community testing center. Hopefully, even by tomorrow, we should be able to announce it. Unfortunately, you can imagine with the weather, we've just been further delayed. So we are very hopeful that we'll have a community testing site option available in our community by the end of the week. It will be limited. We will, when we are able to announce it, we'll be having up to 350 slots Monday through Thursdays, and it will be by appointment, and we'll be using the same platform that we use for vaccination towards the end, our VACE Plus. We'll be using that same platform. The main limitation that we have now is just in our laboratory capacity across the state. And so there's so much demand for, and this is for the PCR testing, there's so much demand for the PCR testing that our labs are really overwhelmed. And so we're working with within the parameters that our labs give us. And we're so very, very thankful to have that capacity. So here, as I've mentioned before, Fralin Laboratory, Virginia Tech's Fralin Laboratory has really been such an amazing community resource for us, and they will be the lab associated with the CTC when we are able to announce it. So our plan is Hopefully by tomorrow, we'll be announcing our CTC, making appointments available. And moving forward, we hope that it will be open 4 days a week, with up to 350 slots per day. In addition, we'll continue our community testing events. So at Fincastle and Covington's, tomorrow we have Covington, on Thursday we have Fincastle. Unfortunately, because of the weather, we were not able to have our Salem clinic today. So I hope that that helps.
Yeah, and then just to follow up again about the any support from the federal government that may be coming as far as testing.
Well, so in part, federal funding, well, first, we know that people can go and hopefully order some tests from the federal government, but that really goes through the state. So I defer to the state central office for any specifics on the federal program. We don't get that directly to the localities. Is there any, do we have any evidence at this point that the Omicron infection is going to trend down lately? We're really hopeful that this is our peak. I'm really hopeful that this is our peak, but we just don't know yet. We know that across the country, there are some states that are starting to trend down. We know that within Virginia, there are some localities that are starting to trend down. Southwest has not. Southwest is still in that upward trajectory. So last week, we've reported over 3,000 cases. This week, we're reporting almost 4,500 cases. I really hope that this is it. I really hope that this is the week that goes on record as our peak week for forever. But I just don't know that. I don't have a crystal ball. I think that it makes sense that this would be our peak, but only time will tell. And what I can tell you is that communities that have lower vaccination rates are being disproportionately impacted.
And Dr. Morrow, people have been stuck at home for the last few days due to the weather. Is that a good thing for maybe reducing contact? But if they're stuck in a home with somebody who is COVID positive, what kind of precautions should they be taking?
Yeah, that's a great question, Tom, that we've been speculating, and I have to be very careful that this really is speculation. We do believe that this is a forced isolation for most of us. And so I think that we'll see that just trend wise, we believe that we're at peak. Hopefully, I can't reiterate enough that this is speculation. But I think that many of us, we've certainly had a lot of discussions about this forced isolation period within our own leadership team here at Roanoke City Alleghany Health Districts. And we do believe that this is going to positively impact our curve, because people just aren't about socializing outside of their homes. But you're absolutely right. For those individuals who have been stuck at home, who do have COVID right now, there's a very high probability that there's even more household transmission just because people are stuck together. So anyone, I will say that last week, our positivity rate at our Fincastle event was almost 50%, meaning that of everybody who came to get tested, and some of those were people who were asymptomatic, who were getting tested because they were exposed, 50% positivity rate, but 48+% positivity rate. So it's fair to say that if you have cold-like symptoms, you should presume that you have COVID. And if you're at home living with your loved ones, do your very best to isolate within your home. So if at all possible, and this is not possible for a lot of our families, the person who is ill should be in a separate room, leave food and hopefully a separate bathroom, leave food for that person, try to minimize contact. That's really hard, of course, with children. It's just not possible. But everything that we can do for if you have cold-like symptoms and you're stuck at home, assume that you have COVID and do everything in your power not to transmit that to your loved ones. If you have to leave that room, again, not everybody has that option of being able to have a separate room. Wear your mask around others to minimize that transmission. Wash your hands, and everything that we know that we need to do to minimize the spread. So that's great questions, Tom. And I see there's some questions in the chat. I'm going to have to put on my glasses. Has there been any follow-up discussion with school superintendents following the governor's executive order? How are we doing? So the two separate questions, how are we doing in terms of test kit inventory, staffing to test or evaluate the results? So those are great questions. I just had my weekly phone call with superintendents, and what I can tell you is we continue to work together to try to really balance the needs of our families to keep their children in school and make sure that schools provide the safest place for children and teachers. And so, these are constantly evolving discussions. What I can tell you, and I know I've said this many, many times before, I feel like we're really fortunate to be in a community where our school superintendents, and I'm sure this is true across, but our school superintendents, our school nurses, our school administrators, they are so dedicated to protecting the health of the children and the families that they serve. And I'm going to continue to work with them side by side to make sure that we're doing everything that we can to protect our children. In terms of testing, so testing and inventory continues to be a concern. We are hopeful that we will get some home kits, which we can distribute to some of our more rural areas that have limited access to testing right now. Staffing is challenging, but fortunately we have our wonderful Roanoke City Alleghany Health Department staff. We've got vendor support staff. We have amazing support from our regional EPI office. And as always, we have our Medical Reserve Corps who are just incredible at helping. So staffing is challenging, notifying people is challenging. We know that testing demand continues to exceed testing supply, but we are committed to working together with our community partners and our partners within VDH to do everything that we can to get people access to testing, access to their results in the best way that we can. As we look at school events, is there guidance for schools regarding sporting activity? Should contact sports be suspended? And then the other question is, do I still suggest that parents keep their kids masked indoors? With respect to sporting events, the CDC guidance has not changed. In areas where there is high transmission, high risk events, the recommendation has been and continues to be that during high risk community transmission, and we are certainly at extremely high risk community transmission right now, the recommendation is to suspend all contact sports, indoor sports that are considered risky. And certainly we are in that situation. So, nothing has changed with that. That has been the guidance, and that continues to be the guidance. With respect to parents and children, I know that there's controversy about the impact of masks. From my perspective, the evidence to support masks is strong. And I think that parents really all parents are doing the best that they can, making the best decisions that they can for their children. And I certainly encourage where we have a lot of commingling of different families, different and close contact, that people continue to wear the masks indoors. That's always been our recommendation. I continue to make that recommendation.
And Dr. Morrow, we're about to get millions of new tests flooding the market from the federal government. Is there any concern that people are going to be taking these tests, not reporting the results, and that might skew the statistics and not give us a clear picture of what we're really facing?
Yeah, I think that it's really important as we move forward. That's another great question, Tom, in terms of understanding surveillance. There's a lot of discussion across the country and certainly within Virginia about COVID surveillance and whether we need to pivot away from the daily case counts. And I think that as the tests flood the market, as we become less confident in our numbers because we know that there's gross underreporting, like even now we know that these numbers, this 4,500 represents a much bigger transmission, right? That there are people who simply haven't been able to access testing. There are many, many people who have access to home test results that aren't reported. So as the situation changes, the value of doing daily case counts becomes less, that there's lower value in it. And so I think that a lot of us are considering, how do we transition to not the daily case count reporting, again, for the reasons that you pointed out, but looking at our hospitalization rates, looking at our death rates, and making the surveillance, looking at what we would call syndromic surveillance. So how many people present to the emergency departments, the urgent care, with flu-like symptoms, as well as sentinel surveillance, where we have specific healthcare providers who do a baseline number of tests and submit those reports to the state health department and to the Centers for Disease Control. I think that most of us in public health feel that we are heading towards that, and the flooding of the market, as you mentioned, with home tests, really pushes us even more in that direction. That was a lot of information, but it's a complex answer to what seems like a pretty simple question. And I think the answer is that we're very likely to change the way that we do surveillance, maybe not in the immediate future, but in the near future. Are there any? I think I've answered all of the questions in the chat. Are there any other questions?
All right, hearing no further questions, thank you, Dr. Morrow. I'll get this recording converted and get it back out. If anyone has anything to follow up, you're welcome to check in. Thanks, everyone. Have a great day.
Thank you.